going to provide privacy for my patients. I'm going to introduce myself. My name's Lizanne. I'm going to be your nurse today. I'm going to be doing your feeding. Can you please tell me your name and date of birth? And I'm going to double check it with their wristband. Thank you, Mrs. Powers. I'm going to perform hand hygiene. Put gloves on. And I'm going to lower my patient down. Are you having any pain today? Okay, good. My patient reports no pain. I'm laying them flat so I can perform an abdominal assessment. I'm just going to expose the belly. And I'm going to oscillate all four quadrants, listening for 5 to 35 clicks in each quadrant.
Wait a minute. Sorry.
And then I'm going to palpate. I'm looking for any distension or pain. Do you feel any pain? There's no distension. My patient doesn't feel any pain. I'm just going to cover him back up. Perfect. And put the head of the bed up to in between 30 and 45 degree angle. I'm going to place a chalk on my patient's chest. I'm just placing this so that nothing gets on you. Keep you nice and clean. And then I'm going to the tube stretched out. I'm going to measure the tube starting at the tip of the nose. And I'm going to go down, making sure not to pull on the tube. To measure down to right before the blue, which is 35 inches, which is the same as it was noted in the chart, so that the tube has not moved any further or came out. And I would also check for the x-ray to make sure that the tube was placed properly into the stomach or the intestine, as the doctor would wish. And then I'm going to grab a syringe. I'm going to clamp this, take it out, insert the syringe, and open the tube, and pull 5 cc's of aspirate, reclamp, close my tube, and then I'm going to take a pH dipstick and put my aspirate onto it. And I am looking for the pH to be 5 or less, and for the stomach content to be fluidy and green, which it is. After completing that, I'm then going to go back to my patient's tube. I'm going to clamp it, open it, I'm going to place the syringe in, unclamp it. I'm going to pull all the aspirate out. I would make sure to have a big syringe so that way I don't have to continue to do this. I'm going to reclamp, pull out the syringe, and place this in. And I'm going to empty all of the gastric content into a cylinder, and I'm going to continue to pull the aspirate out, and I'm checking for residual volume to be 250 milliliters or less. If it was above that, I would have to alert the doctor, and I would not be able to do the feeding, but because my patient has less than 250 liters, I'm able to. I'm going to pull my syringe out. I'm going to clamp the tube, and I'm putting the syringe in without the plunger in. And while holding it clamped, I'm going to pull the aspirate in and unclamp to allow the aspirate to flow in. I would continue to do this until I have put all of the aspirate in, clamping and unclamping. Once I have 20 milliliters left, I'm going to clamp it and pour in some water, about 15 to 20 milliliters. to flush the tube. And then I'm going to let the water run in. After that, I'm going to clamp it again, take out the syringe and close it. Place the tube down. I'm then going to check the Ensure to make sure that is the correct one ordered by the doctor and that it is not expired. And I'm going to shake it up. After shaking it, I'm going to clean the top of it with the alcohol swab. I'm going to grab a new plunger and pull out. I'm going to clamp the tube, open it, get the plunger in. While the tube's still clamped, I'll pour in Ensure to the top and then let it flow in. Once it reaches about 3/4 full, I would clamp it again and pour in some more until I have reached the amount that the doctor has ordered for my patient. Once I am at the bottom of it and it's at the 20 milliliters again, I will grab the water and pour about 30 milliliters in to flush the tube and let it flow in. Once it's finished flowing in, I'm going to take out my plunger and reclamp this. And I'm going to clean up. And I'm going to keep my patient in this position for an hour, and I'm going to come back and reassess my patient. Also, while I am feeding my patient, I'm going to make sure that if my patient complains of any pain, I'm going to lower the tube to make sure that it flows slower, or if it's not going fast enough, I could also elevate the tube to make it go faster, and I'll complete everything that I'm doing behind the patient's head so they don't have to see all the aspirate and everything coming out of their stomach.